by the time we get started, please, yes, this is Health Reimagined. Yes, this is the Health Reimagined session. Please enter your LinkedIn profile URL. Let's connect with each other. And let me know how many of you are in the healthcare field. And do a thumbs up, Zoom, whatever you feel. Okay, great. Yes. Yeah, now I can see everyone. Sahar?
Hi.
Great. Yeah, and how many of you want to work in the healthcare field? Again, a thumbs up.
I can start since I just joined. So I accidentally came into the healthcare field, and a couple of 13 years ago, I volunteered for an organization as a data analyst, just to volunteer for 1 or 2 days. And then they offered me a full-time job starting the next Monday. And that's how I got into healthcare the first time. But then after a couple of years, we had a misdiagnosis in the family. And we thought that we need to do something about it. It was a kind of a misdiagnosis which could have been prevented if the right kind of technology was there. So that's how we started, and there's just so much to do within healthcare. So I think, at least for me, I'll be in healthcare for some time.
Great, wonderful. Yeah, so thanks for joining. Sahar is the co-founder and chief operating officer at CloudMex. It's a healthcare AI company that aims to help physicians and patients improve care. And they are working with some best health systems in the country, and she's going to talk about the new COVID tool they have developed. Sahar leads the strategic development, technical education, recruiting, and day-to-day operations. She's involved in crafting the company culture and identifying future growth opportunities. Welcome, Sahar. Thanks. Next, I would like to introduce Karen Shea. Karen Shea is the Chief Technology Officer and Senior Vice President at Blue Shield of California. She directs and develops overall technology strategy to enable digital transformation. She also leads health innovation technology, driving technology-enabled innovation for business growth and healthcare ecosystem transformation. Welcome, Karen.
Thank you, Neha, for having me here.
Thank you. And we have Laura. Laura is the Vice President of Product at Rally Health, where she's leading the product team rolling out machine learning-based personalization to digital platform. Prior to Rally, Laura worked as a product leader at 5 tech companies at various stages of maturity, from pre-funding startup to publicly traded companies. Welcome, Laura.
Thanks so much. I'm so excited to be here.
Thank you. Yeah, so it was, I really liked, Sahar, you said that it was a misdiagnosis in the family, which, made you decide that you wanted to get into the healthcare to solve this problem. So now we would like to hear from you, Karen. What motivated you to have a career and, think of making a career in healthcare?
Sure. And an IT profession in healthcare industry is unquestionably rewarding because there are so many challenges in healthcare, which I view that as the opportunities. And technology plays a critical role. I am a problem solver, so love to be part of the healthcare transformation and bring the healthcare to the digital age. For example, data is the center of everything. However, it is one of the key pain points in healthcare. Today, data is generated everywhere, from hospitals, clinics, labs, pharmacies. Majority of those systems do not talk to each other. The reality is siloed data is everywhere, but a comprehensive health information is nowhere. This causes preventable medical errors, like Sahar mentioned about misdiagnosis. Part of the reason can be because of the data is not available at the point of care, which is one of the leading cause of death. Unnecessary repeated lab tests is another the outcome because of the unavailable data, which is very costly. So all of those cause the delayed diagnosis and the treatment, which of course ends up with a very poor outcome. Let me also share with my personal example. I am the caregiver for my father. He is 94 years old. He had a stroke 2 years ago. Without a comprehensive digital health record about him at the point of care, I served as my father's health record. Can you imagine what may have happened if I didn't mention his medication, allergies, medical history to his ER physicians? It's a life and death difference. So being in IT profession in healthcare has been my passion.
That's right. And it's kind of, I know that many of us face this situation. When we take our parents to doctors, we have this thick file which has the complete history, and sometimes we have to summarize and memorize so that the doctor gets the right picture, and that problem really needs to be solved. Yeah, so Laura, you have kind of worked in other tech companies also, so what motivated you to be in healthcare?
Yeah, so I joined Rally. I just want to give folks a little bit of a background on Rally, so folks kind of know what I'm coming from. So like the other ladies have mentioned, it's no secret healthcare can be really complicated, and Rally makes it possible for you to navigate and manage the benefits that are offered to you through your employer with many different elements of your health journey all in one place. It makes managing your health and care simple and fun, empowering you to choose the right benefits, find nearby care and doctors, learn simple steps to stay healthy, and reap the rewards while doing it. So really the mission of Rally spoke to me. Our mission is to put health in the hands of individuals. So when I wake up each morning and I start working, I'm working to improve health outcomes for the users that we have. And to me, that's something that's really motivating.
That's great. Wonderful. So we talked about some challenges, but would you like to bring up some more challenges which are there in healthcare? So before we talk about how do we solve these problems and how can technology help, would you like to bring up some more challenges which you have personally experienced or maybe heard from others? Sahar, would you like to?
Yeah, so I can go into detail. So it's exactly what Karen and Laura already mentioned, that the data is in silos, it's not accessible, it's not, the right insights are not present at the right time. There is a lot of redundancies, there's a lot of waste in healthcare. Like it's a big industry, but a lot of it is goes into $690 billion goes to in waste, and that doesn't include fraud. So there's just a lot of administrative complexity. So there's a lot of issues, whether you look at on the clinical side or administrative side, a lot of opportunities for improvement. So the family member that I mentioned, he had, the reason he had a misdiagnosis was that he had frequent headaches and he went to the ER, but he was diagnosed both times. He went to the ER twice and was diagnosed, discharged both times, because what he was having was subdural hematoma, which is kind of a brain bleed. And that wasn't caught on time. And the reason is that he did not show any typical signs of a stroke, which are slurred speech, difficulty walking, etc. So he appeared normal, so they didn't do a CT scan. But a few months ago, he had a stent placed in his heart, and he was on a medication called Plavix, which puts certain patients at a risk for bleeding. And so the doctor did not correlate the bleeding and the headaches with Plavix, and they didn't do a CT scan. And so he had to have an emergency brain surgery, 6 months of rehab. He's fine now, but all of that could have been avoided, this is just one example, with the right insights at the right time. And that's when we started talking to a lot of doctors, and we discovered that this is a very common problem, not having enough data, or having too much data, not enough time to sift through it. Like if you have a patient, you only have 7 minutes face-to-face, how much information are you going to get for that patient? So, and a lot of times this information goes missing. So on the clinical side that happens. Administratively also it is a very complex system, and a lot of it is done manually, which can be automated. So a lot of opportunities for technology to play a role. And the biggest issue is data is in silos. There's a lot of work done to improve interoperability, but still there needs to be more work done. Standardized has also been done to some extent, but again, data sharing, data accessibility, these are really big issues.
Yeah, that's right. And other than care delivery in care management or administration, Karen and Laura, do you think that there are some challenges which can be addressed with technology?
You said
Absolutely. Go
Oh,
ahead.
sorry, go ahead.
Go ahead,
Go
Laura.
ahead. I was just going to clarify the question.
Yeah. Oh, I was just more challenges. I think I cannot speak for more about all the challenges we are facing, the siloed data, the siloed care delivery, and the real siloed experience of members, and also for the doctors. So there are all those fragmentations cause very high cost, very low quality, and a poor experience.
Yeah, so clarifying my question, that other than care delivery, like care management or administration from payer point of view, and the players who are other than providers, any other challenges do you feel which are there and technology can solve?
I mean, I think lack of transparency has been a big problem in healthcare. Like my friend, she gave birth several years ago, and she was from out of the country, so she really needed to shop for the most for a cost-effective place to give birth, and it was very difficult for her to get information on how much is it going to cost to have a baby, which is, you know, a thing that happens all the time at this hospital versus other hospital. Not only would they not know the answer even to be able to provide an estimate, but they tended to be sort of baffled by even the question. So it's pretty surprising the lack of transparency there is in terms of how much things are going to cost, how much drugs cost, et cetera. So that's one of the things that we're working on at Rally, is to bring more transparency into how much things cost.
Great. Yeah, and I was Rally Health's website, and it said it should be easier for people to manage their health, and they help in simplifying healthcare. Great. Yeah, so Seher, this question is for you. So last time when we met, you were talking about the Cloud Medex tool for COVID-19. Would you like to tell us more about that?
Sure. So we have a number of tools, but two primary tools. One is for the general public, which is a free risk assessment tool. So based on your symptoms, geographic location, exposure to the disease, and other risk factors, like what is your age? Do you have any other additional diseases like heart disease, diabetes, etc. It tells you whether you're at a high, medium, or low risk for infection. And if you are, what should you be doing next? What are the nearest testing centers near you, etc. So this is for the US. The other tool is also freely available to the public, and is also a very important tool for public health officials, government, and employers to visually see the impact of COVID in terms of hospital utilization, unemployment rates. How is it affecting? We all know that it's impacted the economy really badly, but how much? So at the state level, at the county level, city level, you can dig deeper and get all this information. You can see, are people adhering to shelter in place? What are the infection rates? How is the outbreak spreading? Is it going up, down, etc. So there's a lot of information for administrators at the county, state, hospital, as well as employer level, which is designed, so the tool is designed to help them in reopening. How much should you reopen? How much workers should come in? How much testing needs to be done? It also has additional functionality where you can run scenarios to see how it impacts the spread of the disease. If we open it too soon, if we restrict travel, or we loosen the restrictions, how would it impact? So, and this is, we launched it with our partner Anthem, which is available at c19explorer.io. Anyone can go and plan accordingly and see what's going on.
Great. Could you please put the link in the chat so that
Sure.
participants can try that out? Yeah, so we talked about problems. There are multiple problems in healthcare, and data is at many places, but the right data which is needed at the right time, that's not available. So Karen, my question to you is, how can we leverage technology, and what technologies can be leveraged to solve this problem?
Yeah, I work for Blue Shield of California. We have a vision of a healthcare system that is worthy of our family, friends, and sustainably affordable. To achieve this, we are taking the bold steps to reimagine health that puts people at the center, supports doctors to focus on delivering best care, clinical care, and also engages local communities to improve the holistic health of individuals, not wait until people get sick. Way before, how can we be more preventive and stay healthy? So we started our transformation with data. For example, we are creating and piloting a new innovative shared decision-making experience with an AI machine learning-based technology tool. It utilizes evidence-based clinical decision models, patients' comprehensive health data, personal preference data, and the social determinants of health data to provide insights and help guide the doctors and the patients to develop the condition-based personalized treatment plan. Consider a breast cancer patient. If her genomic profile indicates that she is not a good candidate for chemotherapy, she can avoid a difficult, very expensive treatment that are clinically proven not to be effective. So our healthcare transformation starts with data. The data leads to AI machine learning driven insights. The insights guides personalized care actions, and the actions drives healthy outcome with high quality of care, low cost of care, and a better experience for patients and doctors.
Right, that's right. Leveraging machine learning. Would you like to talk about, Laura, how we can use machine learning for solving healthcare problems?
Yeah, absolutely. So to Karen's point, really, it starts with pulling together all the siloed and disparate pieces of data together into a single view. So common standards will help a lot with that. Things like FHIR, increasing use of APIs and SDKs. So instead of the provider seeing one single view from that provider's history with a patient, the provider should be able to see data from your device, like your Apple Watch or your glucometer or your scale, your activity level. They should be able to see data from the EMRs from various different patients. They should be able to see your self-entered data, a quiz in terms of how are you doing mentally and physically in terms of activities. They should be able to see disparate lab results that may be from that provider had ordered and other providers had ordered. So like the very foundational piece is this interoperability of the data. Bringing it all together. Like Karen mentioned, we're doing a lot of that at Rally with our platform, pulling in the device data, the health assessment data, data from claims, et cetera. Once you have that, machine learning can be very powerful in identifying the next best action for the user to take. So we do that within our mobile app to tell the user, you know what, you have this program that you could really benefit from to help you manage your diabetes or manage your COPD or maybe lose weight if you have a little weight to lose. They could be provider facing as well. There's a technique in ML called BERT, bidirectional encoder representations from transformers, that has some effective applications with the clinical domain. It's essentially a neural network-based technique for natural language processing pre-training. In kind of layman's terms, it's a better way for computers to understand context. So if you think about, one of the big challenges with healthcare today is that a lot of data is in claims or it's in notes that physicians have left, which from a machine learning standpoint tends to be difficult to deal with, to train with, to understand. So BERT and other similar techniques that are just kind of coming out now can be good for taking these massive sort of disorganized sets of data and putting them into more kind of structured forms that are easier to use and make predictions on.
Yeah, so that's definitely, thanks. You mentioned the challenge. Karen, would you like to bring up any challenge? Yeah, we know that data is siloed, but how do we bring the data together and what's stopping us from doing that?
Multiple reasons. There are security concerns because of the data is actually in a high demand of exchanging from place to place. And also the clinical data has a lot more different vocabulary level. So the semantic interoperability is an issue. The other reason is those data being generated in everywhere. It's everywhere, and those systems are not talking to each other, right? Whether it's on average in American, an adult will you visited about 19 to 20 different care providers, whether it's dental or vision, your primary care specialist, lab system to pharmacy system, any place. But a lot of those systems generates data, but they don't talk to each other. So you do not have a longitudinal view or comprehensive view about specific patient's health information.
That's right. Yeah, data is everywhere, but comprehensive view is not there. Sahar, any challenge you would like to mention? We talked about security, we talked about the data, the codes, ICD codes and all that. It's very complicated to understand. Any other challenge you face which is stopping us from getting a comprehensive view of the data? Or
So yeah, these are the challenges, data privacy. So the way we handle these challenges, there are challenges, and this is why we exist as a company, because these are challenges. These are exactly what we're solving. We do a lot of NLP to read doctors' notes and do machine learning on top of it. We use the doctor notes to generate ICD codes directly from reading the doctor notes, as well as the patient medical history, which is again a very, very manual process. So we do automate that as well. On the clinical side, as Karen also mentioned, Laura mentioned as well, we do a lot of prediction. If you are a chronic kidney disease stage 3 patient, what is your likelihood of going into end-stage renal disease, so that you can plan better. If you are a hospital, so we sell to hospitals, payers, providers, payers, and patients. So we have tools for all, because we don't think that just solving for one would solve the problems that we have. So if you're a patient and you're seeing a cardiologist, a dentist, so you can get all the information in one place, in one platform, and then you can share it with your doctors. So that would make it much easier to have all the information in one place if, patients should be at the center of care. But there are a lot of issues. There are a lot of privacy issues. There are a lot of issues with uploading data on the cloud, etc. So we do a lot of integration. So we have to work within the constraints and the organizational restrictions. So so the way we do our deployments to solve for some of these challenges is that we do on-premise deployments, mostly for hospitals, because they don't want their data to leave the premises. And then or on a private cloud of an organization like Blue Cross or any other organization. So you have to bring change. It cannot be a complete disruption of something completely that people are not comfortable with. So seeing what the challenges are and what the restrictions are, you work within those parameters and find a solution. So the challenges that we had when we started the company was mostly around a new product, which is not vetted yet, that doesn't have validation. So the way we solved that issue was that we got a flagship customer, and we got some clinical validation through that customer, and then others followed. So any new company that comes in to the market, there are other kind of hurdles as well, which are beyond the healthcare hurdles, which is like a new product, how can I trust it? And people's lives are at stake. So you cannot just start using an unproven product. So then we did a lot of work around that to prove that it works, and then scale from there.
Right. Yeah, there are boundaries and we work within those boundaries. So we are getting some questions. So now I'll go to questions because we want to make sure that it's interactive and participants get the maximum. So there's a question for Karen. How do you recommend or enforce the practitioners to share data with each other? So can a pair do something so that some providers can share data with each other?
That is a challenging task, very challenging. As I mentioned, there's concern around the security, the concern around the data, the semantic interoperabilities. However, there are, as Laura and Sahar mentioned, there are many technologies can enable that security, can enable the interoperability of data. What we can do is actually to really show how the data can truly bring value. As I mentioned, once you have a comprehensive patient health record, see how much you can do even at the point of care. Some of the testing you don't need to repeat it, which is already on the record. And the patient has a certain drug allergy, you don't need to test, you already know what you should avoid, the preventable medical errors. And all of those is also very costly in addition to the quality concern. And on average, there is an estimate that about every year, $20 billion, hospitals spend $20 billion for repeated x-rays. A huge cost that can be avoided if we all enable, participate the comprehensive health record.
That's right. Yeah, and at the age of 80, 90, that's the last thing you want to do, is to go and get another x-ray done or another MRI done. That is so painful. Now I have a question for Laura and Sahar. The question is, how are you responding to using data that will be made available through APIs due to the CMS interoperability and patient access final rule?
So kind of building off of Karen's last comment, we have a digital offering called the Individual Health Record. It's essentially the combination of various different sources of health data. Could be from different providers, could include lab results, maybe biometric test results. In the future world could include things like device data, et cetera. So there's sort of like a central digital portal, a mobile app, or a set of pages on the web that has your complete history. So in a first phase, you print it out and you could take it to your doctor, and then they have the full record. In the future world, I think it works similar to, the digital hotel keys or Apple Pay or something, where there are no triplicate forms at all. When you go to the doctor or either the ER, you just kind of press a button. You say, okay, yes, I approve sharing this record with this provider. And then boom, they have all of your health data. And as new APIs become available, we definitely look to take advantage of that and provide users with the most holistic view that we can. And also pretty central to that mission is giving them the opportunity to put in feedback, like this record is erroneous, put in those types of comments so that we have that feedback loop and can make sure there's quality. Because I know on the personal side as well, I've seen stuff in my medical records that was just not correct for various reasons.
Sahar, would you like to chime in?
Yeah, sure. So the question is regarding CMS interoperability and patient access final rules. So we are already integrated with Medicare APIs. So our product called Ask Sophie is listed on Medicare's website, which is a consumer tool. Where Medicare patients, it's for all patients, but Medicare patients through the APIs can directly, with a click of the button, download their medical records on our app. So that gives them the advantage of having their health history all the time, which is using Medicare's API through the blue button. So we're already utilizing it right now.
Great. Wonderful.
And Sahar, I just want to add one more point. We, Blue Shield of California, made a significant investment in a non-for-profit health information exchange technology platform company called Manifest MedX, which provides the comprehensive health records targeted for all Californians and available at the point of care, available for preventive wellness management. So we are really, making a great progress and hoping the more adoption by the entire healthcare ecosystem to solve the bottom line of healthcare about the quality, the cost, and experience of care.
And Karen, what else is being done to make this healthcare affordable, like the health insurance cost, other than solving the data?
Yeah, thank you for asking that question. At the Blue Shield of California, our mission is to ensure all Californians have access to high quality care and at affordable price. Of course, technology plays a critical role. We are deploying high-tech, high-touch services. For example, to remove the transportation barrier for our members to access care directly, we have launched a zero-cost medical transportation program with an innovative technology tool to address the rural care areas where it is difficult to directly access care. We are building a virtual visit system that can easily be implemented in these areas. Also, we have launched the data-driven AI machine learning enabled holistic health program to address key social, environmental, genetic, and behavior drivers that beyond the clinical care setting. We have already seen great success with our diabetes prevention program. Through our data analytics tool, we have engaged our first group. About 10,000 members on average lost 3.4% of their body weight after 6 months. This kind of weight loss can make a huge difference in their overall health. Research has demonstrated that weight loss between 3-5% of one's body weight reduces the risk of type 2 diabetes by 38%. So what's the impact? Again, first, reduce the cost of care. The total direct and indirect estimated cost of diabetes in the United States in 2017 was $327 billion. Second, improve the quality of care. Diabetes is the number 7 leading cause of death today. Over 34 million Americans have diabetes, and an additional 88 million people have prediabetes. 90% of those prediabetes people don't even know they have it. And most notably, type 2 diabetes can be delayed or even prevented by just appropriate early intervention and a healthy lifestyle.
That's right. Yeah. And that way, it's a good point. We not only have to improve the quality of care, we need to make sure that we bring down the cost of quality, bring down the cost of healthcare. Because I've always been on employer plan and I was on IFP plan for some time, and I looked at the cost and I said, my goodness, this is how health insurance is going to cost, but I'm sure things will become better. Yeah, there is, people want to know what are the opportunities for healthcare in women, for women in technology and business, what are the skills needed. But before I go to that question, there is one question from Lake, and it says, how can we use data to evaluate and I would say rate doctors, providers, and can we take actions like take away their licenses?
So
Or,
Yes.
yes.
Yeah, I think there's a couple things that we can do. One is we can compare what's the overall quality of the health outcomes that we're seeing from different providers in the same specialty, and then we can give members transparency into that. So similar to the way when you're picking a painter or a general contractor or someone to replace your sliding glass door, you go on Yelp or Angie's List and you look at the reviews. Building the same sort of thing for choosing a provider. So being able to make a data-driven decision. If you're going to get a knee surgery, you want someone who does a lot of knee surgeries and has good results with them, et cetera. So just providing that kind of visibility to people so they can take their own health into their own hands and make their own decisions, I think is a key piece. And then additionally, machine learning can be a good tool to prevent fraud, which is an issue in healthcare. And it's something that, with the right data, with the right algorithms, we can identify fraud, we can stop it from happening, and that's going to reduce costs overall.
That's right. Yeah. So Karen, can members see the rating of the doctor before choosing a PCP?
Yes, actually, we are actually also implementing a value-based payment model. We are not just to pay fee for service. We are actually rewarding doctors that they put the quality of care as the major measure, and our member satisfaction as another measure.
Yeah, that's a good point. It's the person who is providing good quality, we reward those doctors. That's wonderful. Sahar, would you like to chime in on rating doctors, using AI to rate doctors?
Yeah, I think there are a lot of things that you can do. You can also, just like there are a lot of quality measures, right? There are a lot of value-based programs that already do that, where they see how different doctors are performing against those measures. So you can have those lists and see which are doing on a number of metrics, whatever you want to measure. You want to see if someone is doing excessive MRIs or, prescribing certain medications more than what's required, etc. So you can create those criteria and certainly evaluate doctors based on that set of metrics. But it can be like hundreds of different ways of evaluating what you consider good versus bad.
Right. And we can put some parameters initially, and then the machine learning learns itself and becomes better and better.
Yeah.
Supervised and unsupervised.
Yeah, supervised, yes.
Okay, so now I'll jump into before some more questions come in, I'll jump into this topic of what are the opportunities in healthcare for women in technology and business? What are the skills needed? What domain knowledge do they need? What technical skills do they need? So Sahar, would you like to take this first?
Yes, so for as an AI and healthcare company, what we look for is people that have good backgrounds in computer science, mathematics, data science. Machine learning is still relatively new, and it's we were discussing the other day. It's really hard to find someone that has a machine learning background as well as healthcare background, domain knowledge as well as technical knowledge. So it's really hard to find, and the way we deal with that is that we pair people with domain knowledge with a technical knowledge. And for even for women, there are not enough women in health tech. In technology, there are less, and then in healthcare technology, there are even fewer women. But I think we are usually, very gravitated towards healthcare because we're taking care of, young children, parents, etc. So we mostly act like a caregiver in later stage in life. So I think we are naturally gravitated towards this industry in general. And there's just a lot of in healthcare generally since there are a lot of challenges, that opens up a lot of opportunities as well. So in all areas, there's just tremendous opportunities for improvement, and that opens up different kinds of doors. But domain knowledge as well as technical knowledge, it's both skill sets are, I think, highly required.
Great, thank you. Karen, what will you say if somebody is in not healthcare field right now? How can they get started?
Yeah, and I would say get started at any time, especially think about the technology and healthcare. There are two ever-changing industries. When these two collide, it creates dynamic, exciting opportunities for all of us in health IT professionals, especially for women. In terms of skill-wise, among all the usual leadership skills, I would like to call out the adaptability skill, because in healthcare, the reform, the government mandates, it continues to change, and technology, of course, ever emerging. So an IT professional needs to be really aware of the latest trends and have the mindset ready to adapt to changing and all the changes around us. Regarding the domain, I would say any profession, the business savvy is so important. Healthcare is increasingly looking for data-driven business intelligence and analytics expertise as it's collect more data than ever. Having business acumen would enable us to ask the right critical questions that help define the right problems and solve those problems in the right way. And it's quite many times in many organizations, we're solving many problems, but we do not have the time to even the business acumen asking, are we solving the right problems?
That's right. Yeah. So
Yeah,
yes, Laura.
I would echo that. I think for folks that are listening that are not in healthcare, that are interested in joining healthcare because the mission and the opportunity speaks to you, like, definitely don't be afraid to come. There are lots of folks on the Rally team that joined without having healthcare backgrounds. I think it's so important to have a well-rounded and diverse team, and having a lot of different backgrounds can really make the team perform very highly. Our team has a number of people with healthcare backgrounds, some from e-commerce, places like Netflix and Amazon and eBay, and sort of everyone brings a different perspective and a history and a set of tools. And so often in the machine learning space, we take one tool or one application that was used in one setting, for example, recommending movies on Netflix, and then we apply it to another setting, for example, recommending programs for a member to join, or articles for a member to read that are related to health, or missions for someone to join. And in a lot of cases, a technique that is used in one vertical or industry can be then reused with some slight modifications within healthcare. And really having that diversity of opinions and experiences, and then a culture where people feel empowered to share their ideas and their experiences and kind of build off each other in a creative way, that's been really great for us.
Yeah, great. And one thing is, there'll always be jobs in healthcare. Other industries may suffer. So if there is someone who is kind of thinking of changing industry, I think healthcare is good industry to be in. It's very satisfying at the end of the day.
Yeah, and for personally for me, like healthcare technology is that you can reach a scale, right? You can reach billions of people and make an impact. Whereas if without technology, you can make a huge change, but that would be limited to a geographic location. But through technology, you can really bring an impact like no other. So I think it's in itself a really big motivating factor to keep in this field and keep growing within this field.
Right. Yeah. So software engineers and machine learning engineers and those who have experience in other fields, where can they start if they want to acquire healthcare business knowledge?
They join a health tech company and like,
Yeah, and sometimes it's a catch-22. They want to join a health tech company and then they need experience for that. So,
like Laura just mentioned that they've hired people from Netflix, eBay, etc. We also have people who have come from smart cars, Microsoft, and other tech organizations. So, if you're a fast learner, you're passionate about it. I think skills can be learned. You just have to have the right frame of mind, and you need to have basic skill set. If you're a good software developer, you can quickly learn the domain knowledge.
Yeah, so then I would recommend everyone, if you're looking for a change of career or industry, go ahead and apply. Don't hold yourself back thinking that, oh, I don't have healthcare experience, because the companies are hiring those who are not from.
Yes, thank you, Neha. We are hiring hundreds of people to help us, join us to reimagine health and make this healthcare ecosystem transformation together.
Wonderful.
Yeah, we're hiring too. I'll put my email in the chat.
Sure. Yeah.
Yeah, same here.
Yeah, that's great. So now, what do you see as the future of healthcare, say 2025? With now all these super passionate people and women in tech joining healthcare, and also I imagine that privacy and security will also be taken care of. We'll have less and less challenges. So 2025, I walk into a doctor's office. What do you foresee as the experience?
I mean, the doctor's office, I think more and more is going to be in your home. So don't mean to flip the question on you, but I think like we're really just at the beginning of this explosion of virtual visits, especially for things like mental health for working parents like me, where it's kind of hard to take the kids out someplace. And I think that that's going to get richer and richer with the incorporation of different types of wearables and devices at home. As well as the growth of like at-home mail-in type test kits to supplement the conversation that you have with a doctor.
Great.
Yeah.
Yeah, especially after COVID, I think a lot of people are there has been a tremendous spike in telehealth visits, telemedicine, and I think people are going to be more and more comfortable with telehealth visits. So there's already such a huge spike in every doctor's office, because it's just no one wants to go to the doctor's office if it's not required, right? If you can get that information sitting at your home.
That's right.
What I would personally want to see is no more waiting, just everything automated. I go there, don't have to fill out any forms. They already know what I'm there for. Just get it done, come back. Have that kind of experience that you have, the customer experience that you have, with in other industries.
Yeah, I envision the future of care will be fully utilizing the AI machine learning enabled evidence-based clinical decision models and combined with their own comprehensive health data, their genomic profile, their personal preferences, and those social determinants of health. So it will combine together. Imagine this, right? When you book for business travel or personal vacation, you book an international flight. the data about you, the AI machine learning behind that will actually remind you to take certain immunization shots to certain location of the world you're gonna go. Imagine that you see the doctors, you can, the appointment scheduling to the registration to the doctor office, all those experiences is really seamless behind that. All the robots does the work for you. And also imagine the future of the precision medicine, right? It is not far away actually. One day, for a cancer patient, the diagnosis and treatment would be directly tied to a genetic mutation the tumor carries, regardless of where it is found in your body. You know, all of those, it is just so, it's unlimited. And I also feel the future is here now.
Yeah,
Great.
I really think building on your point that the incorporation of more genomic data is going to be really pivotal in this next phase of medicine. Like so much today is really just one size fits all. You know, you're depressed, you get an antidepressant, right? But in the future, it should be you get your personalized genomic profile. Maybe you metabolize a given antidepressant like more quickly than average or more slowly than average, right? And if you metabolize it more quickly, then maybe you would do better with a higher dose. If you metabolize it more slowly, maybe you should have a lower dose, right? So being able to sort of understand what are propensities for different side effects based on your genomic profile, or propensity for how quickly or slowly you're going to metabolize the medicine, propensity for even the drug to work versus not work. Like, so that really your care is personalized for you as an individual and not you as someone with a condition.
Great. Yeah. So I see future is bright and things are becoming better and better day by day. Are there any more questions from the audience? If you would like to ask question, I can unmute you as well. Okay, so we have 3 more minutes. Any last piece of advice to our audience?
Neha, I'll get started. And I just wanted to further emphasize that our company, Blue Shield of California, our North Star is to create a healthcare system that is worthy of our family, friends, and sustainably affordable. Technology plays a critical role in transforming healthcare. This means creating comprehensive health data and finding the insights from the data through AI machine learning, leveraging the insights to guide the actions for more evidence-based and personalized care, and finally, driving the outcome of high quality, low cost, and a better experience for our consumers and care providers. Thank you, Neha.
Great. High quality, low cost. Wonderful. Laura?
Yeah, I mean, I would say if you're founding a company or you're joining a company, or you're already working at a company, you know, make sure that you know what the vision, the mission, the North Star is. And it's something that you're passionate about, whether it's improving transparency or putting health in the hands of the individual, or reducing costs or making people live longer, whatever it is. And then make sure that as you set KPIs, objectives for your company, for your team, et cetera, that those clearly ladder up into the mission. So everyone's pulling in the same direction, working towards the same thing, and sort of channeling their passion towards the same objective. Because I think if all of those things are true, you create a force that's just unstoppable.
Right. Yeah, definitely. We are unstoppable and we go in this direction of improving healthcare. And you know, I'm getting wonderful comments, wonderful feedback. So before I go to the feedback, Sahar, your closing thoughts, final words.
Yeah, echoing what Laura and Karen said, we need to get out of experimental care and be focused more on data-driven care, evidence-based data-driven care. So a lot of times, you know, if you're diabetic or any other conditions, a lot of times you're given different kind of medications until they find one that works for you. It would be great if you get the right medication the first time. So make it more data-driven, less experimental, that will have better outcomes for patient, will be more cost-effective, would be a better experience. So that's what we are all working towards.
Wonderful. So less experimental and data-driven, evidence-based. Great, thank you. It was a wonderful session, and I have some feedback. Good session. Thank you for a great session. And Kate, this was such an enlightening and inspiring session. Thank you all. Great panel. Thank you. Wonderful. It was great having you. I learned a lot today, and I'm sure that Parna, would you like to say something? I'll unmute you.
No, I just turned my camera on to say hi. Didn't want to interrupt, but no, it was a great session. Thank you so much. Appreciate it.
Thank you. Thank you, everyone. Thanks, everyone.
Thank you.